Good afternoon and welcome to day 3 of the RSV, the virtual reverse site visit.
Welcome to day 3 of the RSV.
My name is Matt Bancroft, and I am a program specialist with Task and Ship at the National Rural Health Resource Center. As we did in the previous 2 days, I would like to start with some housekeeping. As we get started, as you know, the CVent platform here, you can use the chat box on the right-hand side of your screen to join the conversation, to ask questions, or to just engage with the other fellow participants. You can also use little emojis to like things and give thumbs up, and that'll be important later on during Dennis's presentation. Aside from discussion rooms or breakout rooms, all of our sessions are recorded, and breakout sessions are also recorded. You can play those back immediately in the attendee hub or within 30-45 minutes. All of yesterday's and day one's recordings are already available for you. We also have resources available for you under the top, under materials and frequently asked questions tab. You can find all the links and PDFs for all the presentations that you've seen throughout the RSV, including some resources that have been mentioned during those presentations. Should you need technical assistance, please call 1-833-987-3703. There's also a little button in the bottom right-hand side of your corner that says attendee support or help desk, and you may also click that as well. You can also email them at rhrcsupport@cvent.com. Of course, we encourage your questions and interactions with speakers, with guests, with anything that goes on. So please take the moment now to join the chat. Tell us where you're from. Tell us what temperature it is where you're at, because that seems to be a literal hot topic right now. And so if you have any other questions, please let us know. You can always reach out to us. And today, what we're going to do is we're going to start by celebrating kind of MBQIP and quality improvement. So we're really excited about that. And we're going to acknowledge some hospitals and state flex programs for the Medicare Beneficiary Quality Improvement Project achievements. It's an important part of the flex program, providing data across multiple levels, and it provides us with information on how we can best serve our communities. We all know data is important, and later on today we'll send you a link to a post-event assessment. We would love for you to take that. We also use data to help improve our services and things that we present to you as well. With that in mind, the Federal Office of Rural Health Policy has identified several hospitals and states that they would like to acknowledge during this year's event. I will now turn it over to Laura Seifert with FORP to share with you more about this year's recipients. And Laura, I'll hand it off to you.
Hi, Matt. Thank you so much for the introduction. You may be noticing that I am not Natalia. We're rolling with the punches here. We had a little bit of some technical issues, but
Yes,
Matt is the best at handling tech issues on the fly. So everybody give a shout out to Matt. We're going to go ahead and share Natalia's presentation. She's got a few slides to share. And then at the end of the slides, we're going to have a nice fun video to celebrate all of our wonderful MBQIP awardees. So Matt, can you go to the next slide, please? All right, so just really quick, we're going to have a quick presentation today. We're going to talk a little bit about the future of MBQIP, and then we will have one award as the Flex QI Award, followed by a separate MBQIP Performance Awards. Next slide, please. All right, so as you know, we have been working very hard on the vision for MBQIP and what this means for the future, right? So really the whole purpose of this, we know the vision was to improve health outcomes of rural populations by improving quality of care. So this is, we kind of broke this down into two goals, and I break down everything in my life into two goals, right? Short term and long term. So short term was to maintain the progress towards quality improvement activities. Long term, what we're really trying to do, you've heard this in every Archita VKG, every Flex update, is that we're really trying to create a rural, relevant, flexible measure core set with a focus on rural healthcare systems. So what we really want to do, designated by FORP, we want to promote improvement in quality outcomes, not just reporting, which is what we've been working on before, but we want to take that and move it towards actual improvement. Next slide, please. So what we've done, we've launched efforts with MBQIP to promote voluntary quality reporting in order to support these critical access hospital efforts. So as you know, under current statute, all PPS hospitals are required to submit their quality data to receive their Medicare payment. CAs are not paid using the PPS, so they don't have those same requirements. But previously, our FRHP funding from the Flex program supported that quality reporting, and it had identified a set of existing quality measures that were most relevant. Now we've got strong reporting systems, which is really great. We're working on it. And those eligibility requirements were a mechanism to drive that quality improvement. So we're really seeking to build on that. And what we've learned so far, we know MBQIP has been around for a while, and we're really, step by step, getting to the future of MBQIP. So, but that measure reporting that we've been working on before is an integral part of the mission to support these critical access hospitals and high quality care to those populations. Next slide, please. And you can see, this is why I love Natalia's presentations. Natalia did a lot of work to put this together. But you can see how much goes into what happens with this rural measure core set, right? It's not just current MBQIP measures like we have. Natalia's been working and doing a lot of work with other CMS measures, the ECQMs, COVID measures. There's CDC measures. There's HQIC and CHART. There's rural emergency hospital, telehealth informed measures. There's Indian Health Service measures. She's working between HHS and HRSA measures. There's the financial and new payment model measures, and everything as far as population health and health equity. So there's a lot of things in the long-term effort that are coming together to build our rural measure core set for MBQIP. Next slide, please. So our short-term goal, the progress towards these QI activities. We want to learn directly from you, from the states that are making these quality processes meaningful to hospitals. So we always say that this is a partnership between us and between you as the state flex coordinators. So it's really important to help us inform our national planning. And I know Natalia's been working a lot. She's interested in convening an advisory group to inform the design of a critical access hospital assessment pilot. We can give a little bit more information on that, which actually I believe is our next slide. Matt, can you go to the next one, please? Perfect. So what we're doing, we want to identify useful information that the state flex programs need and help meet those federal aims to enhance quality improvement. So we're going to be asking for states to support this assessment pilot. We're going to give a lot of information you can see at our next MBQIP VKG on September 15th at 3 p.m. But we need some volunteers to provide direct feedback to us via these focus groups to kind of help reach a better understanding of what the cost service lines are, right? What their performance goals are, what QI standards are. And there's going to be multiple opportunities to provide feedback on this. The best example I can give you is if you've ever heard Carla Wang, I'm sure she's listening right now, but she always says, if you're having babies in your hospital and you're providing maternity care, there should be maternity measures, right? So we're trying to get everything on the same page of what services these CAs are actually providing. But we want to integrate your ideas as a state flex coordinator and the SOARs into what this assessment might be. So stay tuned. And the first opportunity we're going to talk about this is at the next VKG. Please come ready with questions and ideas. Feel free to reach out to Natalia in the meantime if you have other questions, and she can give you more information on all of that. Next slide, please. So now we get to go into the fun part, which I always love doing, which is recognition and MBQIP awards. So we want to recognize all the efforts of every state who's out there, all of our state flex coordinators who are encouraging all of this participation in MBQIP. It is really a state and federal partnership that we have to meet our mission. So this presentation is just a way for us to remind everyone what's to date. So we have 2 awards, like I mentioned. The first one is the Flex QI Award. That used to be the MBQIP Spirit Award. And so that recognizes a state's outstanding efforts to execute Flex Program Area 1 activities, identify creative ways to maintain hospital engagement and quality improvement, overcome challenges, and bring fresh and innovative ideas to address needs in their state with the overall goal of improving quality of care. Now, that's different from our MBQIP Performance Awards, Those recognize the efforts in reporting measures. So those are ranked, but we know the state flex programs play a key role in making sure your hospitals are doing their reporting. So without further ado, if Matt can go to the next slide for me. Our winner for this year's Flex QI Award is Scott Daniels in Hawaii. So everybody jump in that chat box and give a huge virtual round of applause for Scott. We know how much work he does in quality improvement, and we are so excited to recognize him in this way. And to continue on the fun train, Matt, next slide, we'll go on to our performance awards, our performance rankings. Oh, sorry, one more slide. Congratulations, Scott. All right. So our top 10 this year with our MBQIP Performance Awards, you can see this is the rank order. So we do have some ties, but we've got Utah, Wisconsin, South Carolina, West Virginia, Nebraska, Maine, Pennsylvania, Michigan, New Hampshire, and Virginia. Major shout out to all of those state flex coordinators. And I know you've got quality folks that work in your office. Your SOAR directors are helping you out. It's a huge partnership, and we thank you so much for everything you've done. We're going to do a little bit of some recognitions here. So Matt, next slide. First up is Utah. We're going to say a big shout out to Mason, our health program specialist in Utah. Again, everybody get in that chat box and say congratulations. Welcome him to the Flex world. We are very excited. Utah is #1 this year in MBQIP reporting. So congratulations, Mason. Next slide. And this is just, again, shouting out all the states that are that have been recognized this year that are part of our top 10. And the next slide, I believe, should be our video where we have a few states ready where they've been discussing what quality improvement really means for them in their state. So I think that's where I turn it back to Matt, and Matt will play this video. But I'm not going anywhere yet.
Hello everyone, my name is Britton Herbert, and I'm proud to represent the South Carolina Flex program. We are a small but mighty group of critical access hospitals in South Carolina with only 4. 2 of our CAWs have been in the NRHA's top 20 for quality within the past couple years, and another was selected as an HCAHPS high performer. I asked for input from our CAWs for this, and all wanted to be sure I expressed the benefit of having a Flex program to support their quality endeavors, and an appreciation for the Arquita team and the resources they offer. Quality projects from our SC CAWs include standardizing processes, focus on implementing proven best practices, increasing contact with patients both inside and outside of the hospital walls, driving towards interdisciplinary care teams, and more. Through our Flex program, we convene the CAW quality work group regularly to share lessons learned and updates amongst fellow CAW quality leaders. They offer feedback, insights, and new project ideas to consistently move each other forward. Quality is not an act, it's a habit. Most of our quality teams don't have many people, and those they do have wear many hats. They have roles and responsibilities beyond quality. But they apply this standard of excellence to all they do, and leadership helps ensure they have the tools needed to succeed. I'm proud of our SC CAWs. Thank you.
Hello, I'm Lisa Lewis, Associate Director for the West Virginia State Office of Rural Health. I am delighted that West Virginia has been named one of the nation's top 10 performers on MBQIP, and I'm so happy to be able to make a few remarks on behalf of our state's network of CAHs. At the state level, we are truly humbled by the resiliency of our CAHs during a hopefully once-in-a-lifetime pandemic, which has brought about unforeseen difficulties in the healthcare landscape. During the past 2 years, the CAHs have endured massive shakeups and changes in their health delivery environment. They saw the loss of most of the outpatient services for many months, as well as seeing higher acuity patients in their hospitals. In the face of this adversity, the CAHs adapted and provided the care needed in their communities. This, however, did not come without major challenges to the CAHs, both financially and in terms of staffing. Many tenured staff have taken on additional duties to assist with pandemic response, and new staff, not all of which may be familiar with MBQIP reporting requirements, have had to join in the QI efforts. Even in the face of this adversity, the CAHs were determined that they would continue to report on the program areas. There was collective agreement that West Virginia should maintain its MBQIP reporting uninterrupted, despite the difficulties brought about by COVID-19. The general thought has been there will always be competing priorities, so we should continue to report the needed data and to do so in a timely manner. This just goes to show our state's commitment to quality. We are so proud to be recognized as one of the top 10 MBQIP programs, and we could not be more thankful for the commitment of our West Virginia CAHs. In addition to their many other achievements, West Virginia CAHs scored significantly better on all EDTC scores nationally and had a 100% reporting rate for the 2020 HCAHPS quality measures. Finally, I would like to take the opportunity to thank Diana Yokes with the West Virginia Hospital Association for all of her dedication and hard work she has put in over the years assisting West Virginia's critical access hospitals. I would like to also congratulate her on retirement and wish her well.
Hi everybody, this is Nancy Johansson. I'm the Flex Coordinator for Nebraska. I send you our greetings from the Husker State. I'm thrilled to be accepting the Top 10 MBQIP Award on behalf of the quality staff in Nebraska at our critical access hospitals. The quality improvement staff in Nebraska have really embraced quality improvement within their facilities, and they retain this commitment even through the COVID epidemic. Each year, they choose a focus area within their state regional network and utilize the MBQIP data to inform their program improvement efforts. Nebraska has 5 regional networks, and each network has their own focus. This means that we have several quality improvement projects occurring throughout the year. Each region meets on a regular basis to review the MBQIP reports and to discuss progress on their quality projects. This allows the hospitals to make ongoing adjustments as needed. Hospitals also use the data to help direct individual projects within their facility. So lots going on around quality in Nebraska. Thank you to FORB for this recognition. I'm so proud to be able to accept it on behalf of the Nebraska hospitals. Thank you and take care.
So hi everyone, my name is Clarissa and I oversee the Flex program here within the Commonwealth of Virginia, and I'm excited to accept this award on behalf of our amazing hospitals as well as our state quality partners. So I'm happy to brag about one of our quality centric programs that we offer our rural hospitals. It's called the Rural Hospital Coaching Collaborative, and it's open to not just our critical access hospitals, but our SHIP eligible participants as well. So usually this past couple of years, we've been offering this program through a series of webinars, one-on-one coaching calls, leadership workshops. But this past Friday, July 8th, we were finally able to get in person. So we gathered 28 rural hospital leaders representing 11 rural hospitals in one room. And we played games. We talked about bright spots regarding care transitions, commit to sit, all these different quality initiatives. And then we even talked about discussing the psychological state and reporting adverse events in their facilities. We ended by talking about COVID and looking at it from the rearview mirror and recognizing there's still work to be done, but we're on the right path. So I just wanted to thank you all again for acknowledging Virginia, and I'm excited to share this with our hospitals and our leaders. And I hope everyone has an amazing rest of their first state visit.
The Michigan Flex program is proud to be a top 10 state for MBQIP performance and reporting this year and since inception of the program in 2017. The strength of the quality component of the Michigan Flex program can be directly attributed to the support provided to the Michigan Critical Access Hospitals by the Flex-funded Michigan Critical Access Hospital Quality Network. This impressive network of critical access hospital quality leaders, founded in 2001, truly support and empower each other to provide high quality, patient-centered care to their respective rural communities. All Michigan CAHs are members of the network. They meet on a quarterly basis to benchmark key clinical data, such as MBQIP, present on best practices, and share safety stories and lessons learned. The meetings are truly special, where folks have a place to learn from each other and learn with each other. The group is led by a 12-person executive committee with a diverse representation of independent and system hospitals in a wide geographic diversity. Mariah Hess, Chief Nursing Officer of Sparrow Clinton Hospital, has served in the president role since 2018. She's really elevated the culture of the network to focus on patient safety and quality, a common thread among all Michigan critical access hospitals. In addition, Jen Manzo from McKenzie Health System, who also serves as a quality improvement mentor with Stratus Health, is chair of the Data Management and Analysis Strategy Group. This group provides technical assistance and education around data requirements for Michigan critical access hospitals. This includes the MBQIP quality metrics. They both have made a group motto of sorts: no critical access hospital left behind. One meeting, they actually made t-shirts with this slogan on it. And I think this is a nice representation of their dedication to each other and showcases that they also have fun with this work. In addition to the quarterly meetings, the network allows for relationship building among members, connection within the 3 strategy groups, and communication via a listserv. The network has come so far in terms of quality reporting, performance improvement, and transparency since 2001, and I'm proud to work with them each and every day. Thank you to HRSA and the Federal Office of Rural Health Policy for recognizing all Michigan critical access hospitals as they continue to provide exceptional health care for their rural communities.
My name is Darlene Laro, and I'm the Rural Health Manager for the New Hampshire Office of Rural Health and Primary Care. In this role, I manage the Flex and Shift grants. When thinking about quality improvement work that I take the most pride in, a couple of items come to mind. I take pride in making the Excel charts that go out with the reports that we receive from the federal office. When providing technical assistance, I'm proud of when I'm able to find the answers that the hospitals need. Another area that I'm proud of is our quality improvement project. This project has involved 8 of our 13 critical access hospitals QI coordinators meeting together to share ideas and approaches for preventing falls at their hospitals. In addition, the QI coordinators have said these meetings have helped them feel less isolated, knowing that other QI coordinators are having the same challenges that they are. So whether it's been through the technical assistance calls, providing data and charts, or working on the QI project, we have been building relationships between our office and each hospital, as well as helping to build relationships between the 13 critical access hospitals in our state. So I'm proud of that too. These relationships have helped to provide encouragement, sharing of promising practices, and collaboration among the hospitals. This collaboration is affecting change in the care and consistency of care that the residents of our state receive. As Henry Ford once said, coming together is a beginning, keeping together is progress, and working together is success. It is our hope that this collaborative work will continue to succeed in improving healthcare in our state for all the residents that reside in our rural areas. Thank you for your time, and have a great rest of your day.
Hello everyone. I would like to thank HRSA for giving us the opportunity to participate in the MBQIP program. It is an honor to be within the top 10 states. I would also like to congratulate my fellow top 10 states. The Pennsylvania Office of Rural Health's mission is to enhance the health status of rural Pennsylvanians and to ensure that rural residents have access to high quality, affordable health care. To help meet our mission, the Pennsylvania Office of Rural Health and our state's 16 critical access hospitals work as a team to facilitate optimal patient care across the state of Pennsylvania. Activities that contribute to their accomplishments are quarterly quality improvement meetings, as-needed guidance for best practices, MBQIP data review, sharing successful quality improvement programs, and collaborations. We are fortunate in Pennsylvania that our cause work in alliance, not just to survive, but to thrive. State offices of rural health have an expansive set of resources to help strengthen the rural healthcare delivery system. The Pennsylvania Office of Rural Health capitalizes on those resources. We provide training and technical assistance for our cause and our rural health clinics. To improve outpatient measures, we were very successful in strengthening that partnership with Pennsylvania Rural Healthcare Clinics and our critical access hospitals. During the pandemic, our interactions for regular updates and technical assistance encounters reached an all-time high. Pennsylvania Cause and Rural Health Clinics continue to work diligently to provide optimal patient care. It's an exciting time for Pennsylvania and for rural health care. Keep up the great work. Thank you.
Hi everyone, this is Nicole Breton. I'm the State Director for the Office of Rural Health, Primary Care, and Oral Health for the Maine CDC Department of Health and Human Services. I'm very excited to hear that the Maine Flex program is in the top 10 for quality reporting for the MBQIP program. The quality improvement work that we do is very important to us and our critical access hospitals. Our core mission of our office is always to promote access to quality health care for our citizens living in all of Maine's rural and underserved areas. Years ago, a hospital CEO told me when I first started in the program that we need to sink or swim together to navigate these turbulent waters. And in true partnership, we have worked closely with all of our hospitals through some very turbulent waters. We meet with our hospitals quarterly. They share their data unblinded. We provide subject matter experts. We bring together educational materials and resources, and we share best practices. We also review their data unblinded and try to identify some root causes that may be impacting their data scores in their reporting. I can truly say that our work with our quality improvement has been a highlight of my career working with the department. This is a strong, robust group, and at times when some of our quality improvement directors have left to take another position or have gone to work with another hospital, they always want to stay connected to our program. Again, I thank you for giving Maine recognition for their quality improvement work. We will continue to strive forward and improve and provide access to all of our citizens and living in our rural state. Thank you.
Congratulations to the top 10 states, and thank you to the federal office for taking the time to recognize us and all the great work we do with the Flex funds and the MBQIP program. And I want to take the chance to thank Task for all that you do and all the resources you offer, all the education you offer, as well as Stratus. Bringing Stratus on board has made MBQIP incredible and has really strengthened the program. So thank you for that. We've been through a lot in the past 3 years, and I would be remiss if I didn't thank the federal office for listening to us as Flex coordinators and knowing our workloads changed. And we started doing things we never thought we'd have to do, tasks that weren't in our purview when we took the job. Nobody expected this pandemic. So thank you for understanding as we wrote the Flex grants and as we encouraged hospitals to continue with MBQIP, knowing what they were going through and what a hard time this was. So thank you. Thanks for this award, and congratulations again to all of the state offices.
All right. Thank you so much, everyone. And congratulations again to all of our states for the MBQIP Awards. And I don't know about anybody else, but I was just sitting back here dancing at my desk, listening to all that great music that Matt put in that video. So thank you, Matt. As you can see, just our final closing remarks here. This is a quote from Natalia that she wanted to put in. The future happens as a result of what we do today. And I could not think of a better way to end this. You know, we know that there's a lot of things that are happening and a lot of changes that happen literally minute to minute in the world of healthcare, and especially in the world of quality improvement. And none of this happens, none of our work at the federal level happens without what you all do at the states. And Catherine just mentioned it in the video. We are here to listen to you, and please tell us what we can do and how we can make this program better, what you're doing right now that might help improve what we do in the future. We are always here to listen and hopefully make our program better. So if anyone has any questions about anything that we mentioned in the presentation today, you can reach out to Natalia or to me, and I can forward your email wherever it may need to go. And with that, I will kick it back over to Matt, and I think we're going over to breakouts.
Yes, absolutely. We will be going to breakouts in just a second. Thank you to everyone who submitted videos, who were did a fantastic job with quality improvement this year. It's always fun to watch those videos and hear your words and to hear your comments on what you're achieving in your states. And thanks to everyone who joined the chat room and gave kudos to those states. If you get an opportunity sometime this week or next, send an email to those states, to those workers, and let them know that you appreciate their hard work. And also see it as a challenge. Any state can be in that top 10. And so we know that any one of you could easily be there next year and be that recipient next year and get recognized. So that's not in lieu of everyone else's hard work. It's in addition to everyone's hard work. So we really appreciate you and appreciate your efforts. Laura, thank you for jumping in due to the technical issues. Laura literally jumped in like 2 minutes before we went live and was able to get this taken care of. So thank you to her. And we appreciate your efforts as well. So yes, as we wrap up now, we will be going to breakouts. Later on, we will have a leadership session with Terry and Shannon Studden. And then we will close out the day with a keynote presentation from Dennis Wagner. And all of those things look to be fantastic and engaging and really exciting. So we hope you stick around today. And as we conclude this session, pick your breakout room, and those will get started here in just a few minutes. We appreciate you guys, and we will see you next time.